Welcome to Chapter 9. We are going to talk about the fundamentals of audits. In healthcare, auditing is very, very important for billing to ensure not only are you making money and using money appropriately, but that you're billing and not committing fraud. And intentionally or unintentionally, you can go to prison and pay fines for both. Even if you didn't mean to, you're still held liable to prevent fraud. So, Chapter 9. Due to increasing guidelines each year, auditing has increased in the healthcare facility. Definitely, you want to use more than one person for checks and balances of this type of stuff. That way, you have somebody looking and paying attention and making sure it's done correctly. It's important to link your billing services with what is documented in order to make sure, one, you get the most for your reimbursement, and two, that you're not overcharging or double charging or possibly even charging for something that was not completed. So on page 214 of the book, it goes into the introduction. CPT codes are discussed on page 215. Some of this is very automated in our electronic healthcare record world that we work in now in 2023. But I still want you to read about it and learn about it, how the book presents it. Evaluation and management, E&M code categories in the section on page 217. You can read all about that. Elements of an E&M code on page 219. I'm flipping through the chapter as I read through this. Modifiers are mentioned. Anesthesia. The anesthesia is a very important service code because there's big money in anesthesia. And we want to make sure we get paid for that because anytime anesthesia is administered at a healthcare facility, you have possibly one or two anesthesiologists, which are the anesthesia doctors. And then for that ratio, you would have 10 to 20 nurse anesthetists. So I shouldn't say each, because sometimes a dental office will only have a nurse anesthetist, or outpatient day surgery may have one anesthesiologist and two or three nurse anesthetists. But anyway, I kind of digress there. That's not relevant. But anesthesia is important as far as billing and auditing. Surgery on page 222, very important to make sure we bill and document the correct side of the surgery. Modifiers are listed on the bottom of page 223. Then we go to radiology, pathology, laboratory, medicine, ICD 9. And this kind of shows the age of this book. Let me flip back. I can't remember how old is this book. I'm looking. I haven't lost you. Yes, this is an older book because we are now using ICD-10. That's what I was looking for. So ICD-10, actually, we might even be up to 11 by now. So anyway, page 230 talks about ICD-10, but let me back up. For the purposes of the quiz and purposes of a test or this course, you'll learn about ICD-9 and ICD-10. The Healthcare Common Procedure Coding System, that's HCPCS is the acronym. That is something that is still utilized today, and again, in our electronic healthcare world. The claim form is talked about on page 232, claims processing. Here's an example of a health insurance claim form. Again, in today's world, when you are hired as a health manager of a healthcare facility, you're likely not going to see this on paper because everything is electronic these days. But, maybe you're working rural and that office particularly still uses the claim form and then you enter it into a computer, then that's what it would look like on pages 234 and 235. 236, samples of good and bad audits. Then we have our summary, and you'll take your quiz and do the discussion. And yeah, let me know if you have any questions.